external hordeolum, that is stye. It is an acute suppurative inflammation of a last follicle and it is associated with glands of cheese and mole. Here we have lid and this is eyelashes where this is cheese gland and this is mole gland. So this is suppurative inflammation of a cheese gland and mole gland. So what is etiology behind the external hordeolum? The predisposing factors are age and it is more commonly occur in children and youngs. Other factor is habitual rubbing of eyes or fingering of a eyelid. Metabolic factors like excessive intake of carbohydrates and alcohol. And the causative organism is it is most commonly caused by Staphylococcus aureus. So what are the clinical features? The clinical features are in the early stages, the gland becomes swollen, hard, painful, and usually whole edge of the lid is edematous. So, acute pain associated with swelling of lid, mild watering, and photophobia. And the signs are there are two stages, stage of cellulitis and stage of abscesses. In stage of cellulitis it is characterized by localized firm red tender swelling at the lid margin, and in the stage of abscesses there is a formation of pus on the lid margin. Now what is treatment for stye? The first one is hot compression. It is very especially in cellulitis stage, that is in first stage. Then evacuation of pus should be done. If there is a large abscess, then there is a surgical incision is required. Now we can give antibiotics, eye drops 3 to 4 times a day and eye ointment at time of bed. Systemic anti-inflammatory and analgesics can be given for relieving pain and reduce edema. Systemic antibiotics should be used for early control of infection. And in recurrent style, we have to treat the underlying cause. That is, try to find out and treat the associated predisposing condition. So this is all about the style, that is its etiology, in which the predisposing factors are age, habitual rubbing, and metabolic factors, causative organism, that is the Staphylococcus aureus. Then there is a clinical features, which are pain, swelling, mild watering, photophobia. In sign, there is two stages, cellulitis and abscesses, and after that there is a treatment, hot compression, evacuation of pus, surgical incision, antibiotics, systemic and inflammatory analgesics, systemic antibiotics, and in recurrent style, we have to find out the predisposing condition. Thank you for watching this video.